So in this video we are going to talk about head position or the cervical spine movement, how it affects the blood flow or the neurological space, which movement compresses what. Like all my videos on the cervical spine are so confusing. Sometimes let's say extension compresses the facet joints, but extension and rotation compresses the contralateral vertebral artery. So in this video we are going to straighten out so many things. So start with the two positions, neutral position of a cervical spine and flexion of the cervical spine. Both the components like blood flow and the neurological space remains normal. There is no compromise. It starts with extension. So extension of the cervical spine, blood flow or the space for the blood to flow remains normal, but neurological space gets compressed or compromised. Now, what about the side flexion? So side flexion, there is a little decrease in the blood flow to ipsilateral side. It remains normal on the contralateral side. But the neurological space, it decreases on the ipsilateral side of the side flexion, but increases on the contralateral side. Remember the coupled movements concept. Now, think about rotation of the cervical spine. So rotation of the cervical spine, the blood flow decreases on ipsilateral side, but a greater decrease, very greater decrease on a contralateral side. That's why rotation is a component on a VBI to check, vertebrobasilar insufficiency. We talk about what happens to neurological space. So rotation compresses the facet joints or neurological space on ipsilateral side, but increases on the contralateral side. So remember the coupled movements concept. Side flexion and rotation, whichever side you do side flexion and whichever side you do rotation, that side the neurological space decreases, but it increases on the contralateral side. Now, we'll talk about combination of movements, like what happens in flexion and rotation and extension and rotation. So extension and rotation is very important, or my favorite. So extension and rotation, we talk about the blood flow. So extension and rotation compresses or decreases the blood flow on ipsilateral side, but a very greater decrease on a contralateral side. So that's why VBI in that. So it checks the other side of the vertebral artery. What about the neurological space? So neurological space is extension and rotation, a great decrease on the ipsilateral side. Now, we'll talk about flexion and rotation. What happens in flexion and rotation? So, flexion and rotation, blood flow decreases on both the sides. But again, there is an important part on the neurological aspect. So, flexion and rotation compresses the neurological aspect on ipsilaterally, but it increases on the contralateral side. Thank you.